A family or a patient would get referred to Prof Chatterjee here at Addenbrooke's in Cambridge for further advice and review with regards to signs and symptoms that they're having that maybe could be better managed. Here in Cambridge we do a resting energy expenditure visit, if you like. So we assess the metabolism of that individual, and it could be a child, it could be an adult. And the reason we do that is because we find it very useful to indicate whether that person with resistance to thyroid hormone beta, their metabolism might be acting a little bit faster than the average person. Why would that be useful? For instance, we may target medication if they were having a faster heart rate than usual. We would also do further investigations into that. For children, it's really important that they get support and advice for the family and also for the education as well, for school teachers. Some of the investigations we do are we would do a DEXA scan, so that involves typically a patient, child or an adult, lying on a bed, and we scan from top to toe, and that measures the bone mass, the fat mass and the lean mass, so that's the muscle mass. Muscle mass is really, really important for us to look at because muscle is very important as an energy powerhouse. So that would give us an idea, along with other measurements, how much energy that individual is using. So that's one of the measurements that we use. We also do fasting blood tests, of course. We're looking at an overall picture of health, liver function, kidney function, obviously thyroid function, and also fasting glucose, insulin, for example. Another test we can do is what we call a GEM measurement, and that captures the expired air in a fasting state, in a resting state in the morning of a child or an adult, and those captured, that captured breath, if you like, also feeds into measurements to look at metabolism of that individual. All the tests that we do, apart from the fasting blood tests, are non-invasive. In fact, it involves the patient actually just lying down and keeping still, which for people with resistance to thyroid hormone beta, they often find quite difficult to keep still for a long period of time. Luckily, these investigations are quite short, so 10-15 minutes maximum. And they're very easy. And with this particular research ward, we have a very relaxed atmosphere. It's not an NHS ward, so there's not a lot of noise. Families sleep in the same room, they have their own facilities, so it's very relaxed. And we often will review that patient maybe every 6 months or every year, and so they get used to the routine and they realise that actually it's quite a friendly, calm atmosphere here.